Oh, hello there, beautiful. What is your name? I don't believe I have seen you around here before.
No, this is my first time here. My name is Charlotte. What is your name, handsome?
Charlotte? What a lovely name. My name is Charles. Here, why don't I buy you a drink and we'll get to know each other a little better?
Why, I would love to, Charles.
So tell me a little about yourself. What is a pretty young thing like you doing here alone on a Saturday night?
Well, if you would really like to know, Charles, I am alone on a Saturday night because I suffer from G.A.D and I actually just broke up with my boyfriend.
Oh, I am very sorry to hear you are going through a breakup. But G.A.D. What is G.A.D? I do not think I have ever heard of it before. By the way, what would you like to drink?
I will have an appletini, please.
Sir, I would like some brandy for myself and an appletini for this young lady straight away. Now then, where were we? Yes. What is G.A.D again?
G.A.D stands for General Anxiety Disorder.
An anxiety disorder? That sounds serious. What makes you so anxious? Why don't you tell me more about it? I would love to learn more.
Well, Charles, I do not just worry about one specific thing. You see, G.A.D is characterized by uncontrollable, intense, continuous, unfocused worry that is distressing and unproductive.
Intense worry? I have intense worries sometimes, so does that mean I also may have G.A.D?
Do you have difficulties controlling the worry, feel restless or on edge, are easily fatigued, have difficulty concentrating, have muscle tension or have trouble sleeping?
No, not really. I do not suppose my anxieties are quite that intense.
Then you do not meet the criteria for diagnosis of G.A.D according to the DSM. You see, I suffer from all of the symptoms that I just listed. I tend to worry excessively about minor, everyday things. I also suffer from muscle tension and fatigue. My anxiety is dysfunctional to my functioning, especially my relationships.
Well, I am very relieved that I do not have G.A.D. However, I am very sorry that you suffer from this disorder. What causes someone to develop G.A.D?
That is a very good question, Charles. Similar to other anxiety disorders, G.A.D sufferers tend to have a generalized biological vulnerability.
Biological vulnerability? What do you mean by that?
I mean that we inherit a tendency to be tense, uptight, and anxious.
I do not mean to interrupt your intimate conversation. However, I overheard that you two were speaking about G.A.D. I happen to be a psychologist. And this young female is correct about biological vulnerability. In fact, past studies have found individuals with G.A.D show less responsiveness on most physiological measures, like heart rate, blood pressure, and respiration rate as compared to individuals with other anxiety disorders. But that is all. Carry on with your night.
How fascinating.
Yes, I completely agree. There is also evidence that individuals with G.A.D are highly sensitive to threat, especially when it has personal relevance.
Why is this? This is a curious finding, very curious indeed.
Well, my high sensitivity may have arisen from my early stressful experiences where I learned that the world is dangerous and out of my control. This is normally the case for most other people as well.
Now, can this be considered a generalized psychological vulnerability?
Hello again, and sorry to bother you, nice young couple, but this gentleman is completely correct. I overheard him mention something about a generalized psychological vulnerability. Studies that involved the Stroop color naming task and EEG testing show that individuals with G.A.D are autonomic restrictors, and that they tend to think so hard about upcoming problems that they do not have the attentional capacity left for the process of creating images of potential threats.
Why does this ability to process images matter?
According to therapists, it is important to process images and negative affect associated with anxiety. Because people with G.A.D fail to process the emotional components of thoughts and images, they are never able to work through their problems and arrive at solutions, and therefore become chronic worriers.
Oh, I understand now. Thank you, sir.
You are very welcome. Now have a nice evening.
Now Charlotte, if you are so aware of the etiology of your GAD, what maintains it and prevents you from getting better?
Well, Charles, like the psychologist mentioned earlier, GAD sufferers may inherit a natural tendency to be tense and develop the sense that life is uncontrollable and dangerous early on in life. Then stress due to life events leads to anxious apprehensions, including increased muscle tension, which can then set off intense worries with failed attempts to problem solve and cope. These worries lead to avoidance of imagery, intense cognitive processing, restricted autonomic response, and inadequate problem solving skills, which all then lead to the maintenance of GAD.
Wow, GAD is a lot more complicated than I realized. However, now that you have explained the disorder to me in detail, it sounds very familiar. I believe my brother may also suffer from GAD. He also gets anxious about everyday tasks and has recently been complaining about muscle tension. He also seems much more irritable and restless than he used to be. What can and should he do to get treatment?
Unfortunately, Charles, while GAD affects about 3.1% of the population and affects more females than it does males, it is actually one of the hardest anxiety disorders to treat.
Oh shucks, really?
Yes. Drugs including benzodiazepines are most often prescribed for GAD.
Great. So there is hope for recovery?
Well, while the drugs may provide short-term relief, it is not yet certain how well they actually work long-term.
What exactly do benzodiazepines do?
I am not actually really sure. Maybe that gentleman who keeps coming over to us knows. Excuse me, sir?
Hello again. What can I do for you two lovely folks?
Well, we were just wondering how benzodiazepines are used to treat GAD. Could you explain to us how they work?
Of course. Benzodiazepines enhance the effect of GABA, resulting in sedative and the anxiety state. Common brands include Xanax, Valium, and Ativan.
Don't benzodiazepines have negative side effects?
Yes, you are 100% correct. Benzodiazepines often get side effects.
Negative side effects? I don't like the sound of that. What are they?
Negative side effects include impairment of cognitive and motor functioning. They also often lead to physical and psychological dependence, which makes it difficult for people to stop taking them.
Yet I don't think I would recommend my brother to take benzodiazepines then. Drugs don't work well with his body and he has a history of addiction. Are there other forms of treatment? Charlotte, what are you doing to treat your GAD?
That is a very personal question, Charles. However, because I like you, I will answer it. I am currently undergoing psychological treatment for my GAD. With my clinician, we work on my ability to process threatening information on an emotional level. My clinician makes me anxious by using images, and then has me confront the anxiety-provoking images head-on. I also learned to use cognitive therapy and other coping techniques to control my worry process.
This method of treatment sounds much more effective. Is this cognitive behavioral therapy?
Yes, this is cognitive behavioral therapy. And in the short term, psychological treatments give about the same benefit as drugs. However, psychological treatments are generally more effective in the long run. I recommend telling your brother to go to a clinician for this form of treatment.
Great. I think I will go call him up right now and tell him then. He will be so relieved.
But wait, Charles. We never exchanged numbers. How will you contact me after tonight?
Oh well, I'm terribly sorry, Charlotte, but I really must run now. It's been eventful. Best of luck with your GAD and thanks for all of your help with my brother. Cheerio.